Hi, Sophia.
Hi Kay, how are you?
Good, how are you? Where are you?
Good. I'm at school. I just got out of class, so I'm
Oh, well,
sitting in an empty classroom.
great. Glad it could work out.
Mhm.
Hi, Steve.
Thank you, Sophia. I got in through the wrong link.
Yeah, no worries. I didn't even notice you in there.
You guys got our two new comments that we just received in the last hour or two.
I just saw one of them. Let me look for the other. Oh, yeah, here's the other.
Just keep an eye out for John too, Sophia, just in case he comes through as an attendee.
Yep, I'm monitoring it right now.
Apologies for being off camera. I'm coughing and sneezing.
No worries.
Hope you feel better, Gail.
I think it's just a head cold, among other things.
So we've got a bit of an echo when you speak.
Yeah, it looks like you're logged in twice, Gail.
I'm logged in. Okay, I'm getting out. Is that better?
Yep.
Much better.
Right.
Good.
Sorry about that.
All right. So it's 7 o'clock and I'm going to call the meeting to order. This is the November 3rd, 7 p.m. meeting of the Dover Board of Health. We'll begin with a roll call. Kay Peterson, Chair, present.
John Quackenbush, member present.
Steve, you're muted. Oh, there you go.
Stephen Kresko, member present.
Great, thank you. So also present from the Board of Health are Sophia Kriegsman, Administrative Assistant Jason Belmonte, our Health Director, and Gail Varsa, Public Health Nurse. The purpose of this meeting tonight is to conduct a hearing regarding a proposed regulation about nicotine product sales in Dover. We'll open the hearing shortly, and after the hearing, the board will deliberate about the proposed regulation. First, however, as we do at each of our meetings, we want to have a period where we allow public comments for up to 5 minutes for items that aren't otherwise on the agenda, therefore items that are unrelated to the tobacco regulation issue. Are there any speakers, anyone who wishes to speak from the public in the public comments period?
And just to clarify, comments not related to tobacco or nicotine-free generation.
So now there are none. Is that correct?
Yep, I saw a few hands go up, but then they went down.
Yep. Thank you for clarifying that, Jason.
Yep.
So I'd like to entertain a motion to open the hearing.
So I move that we open the hearing.
A second? I'll second the motion to open the hearing. So let me begin by saying that it is the responsibility of the Board of Health to promote and protect the public health of residents of Dover, and that includes regulating tobacco and nicotine products. The purpose of our hearing tonight is for the board to collect information and opinions about a proposed change to our tobacco regulations. We're not going to be asking for a vote from people who are attending. The board itself will discuss and vote this evening once we've closed the hearing after hearing the comments of people who have attended. I'd like to have Jason, our health director, read the proposed regulation. It's also available online. And then after he's done speaking, I'll review some ground rules for the hearing. Jason, you want to read the regulation?
Yep, just pulling them up as we speak. Yeah, so I guess there's technically a few changes here we're proposing. Some minor for the most part, just housekeeping in terms of signage, checking IDs, but kind of the crux of why we're here today. I'll read this line here. Proposed amendment to section 220-6, retail sale of tobacco products. No person, firm, corporation, establishment, or agency shall sell tobacco, nicotine, or e-cigarette products to anyone born on or after January 1st, 2005.
Okay, thank you, Jason. So let me just talk about the ground rules for this hearing. Anyone present may speak. If you want to speak, please raise your hand using the raise hand function on Zoom. And when it's your turn to speak, you'll be promoted from attendee, which you are right now, to panelist. And your audio and video will be heard by everyone and seen by everyone. Once you've become a panelist, please identify yourself by name, address, and any professional affiliation that you have that may impact your comments. We want you to limit yourselves to 3 minutes, and your speaking time will be timed, and we'll let you know if you run over and you'll need to stop. We hope that you won't repeat what others have said. And please realize that the board members are going to listen to the testimony, but won't engage in dialogue with people who are making comments. We will deliberate after the hearing ends. But tonight we will deliberate. So with that, I think we should begin the comments. So who would like to speak? There are 2 hands up already.
It looks like Jonathan was first, so I will send you an invite now to be promoted to a panelist.
And Kay, if I may, just before we get into the first
Yes.
speaker, I just wanted to mention we received 5 written comments over the course of the last few weeks, 4 of which were opposed to this initiative, and 1 was in favor.
And are some of the people who submitted comments are here tonight? Is that right?
Just about all of them, actually.
Okay. So then we,
Hi, this is Jonathan. I live in downtown Quincy, but I'm active with Cambridge Citizens for Smokers' Rights. So we try to make good comments to allow people to smoke, especially at Board of Health meetings, especially because we aren't really thrilled with nicotine-free generation. And I just briefly wanted to say, as a student and as a worker, I really depended on like real coffee and smoking. And, outdoor smoking in a nice smoking area is pretty good, at least. And I just think, I don't want to hurt these young adults' futures with not having access to smoking, which might really help them with homework and honest work duties. And I feel strongly, so please don't pass it. Thank you.
thank you, Jonathan. Who's next, Sophia?
Stephen Heller had his hand up
Yes,
next.
Steven, it looks like you're next, so I will send you an invite
Helfer, sorry.
now.
So Stephen, you're there, but you're muted. So now your video's on, but you're still muted.
There you go.
I believe I'm visible. I believe I'm unmuted.
Perfect.
Stephen, Cambridge Citizens for Smokers' Rights. We accept no funding from any source whatsoever and are opposed to what is in effect a generational tobacco and nicotine prohibition. Immigrants of color own most of the stores that sell in Massachusetts that sell nicotine and tobacco products. And while municipalities which have enacted this prohibition has not seen any of these stores close, it has hurt and devalued their businesses. For example, in Brookline, Elias Audi of Brookline Sunoco and Afad Ikal of a convenience store both reported to the Brookline News that not only had their cigarette and nicotine product sales decline, but their gas sales and other products have declined. So this proposal would have a significant effect on the retailers in Dover. And of course, one's livelihood is associated with public health. Now, proponents of this say that they're doing this for youth. But in October of last year, the CDC reported the smoking rate among American teenagers is the lowest it's been in 25 years. The FDA in September of last year reported vaping is at a 10-year low for teenagers, and their nicotine pouch use, quote, remains low, end of quote. If the tobacco industry is trying to attract youth, it is not succeeding. In fact, I think this proposal is a stealthy way of introducing prohibition on adults. It will not affect anyone under the age of 21 at all. Now, in Massachusetts, we deem adults competent to make their own decisions regarding marijuana and alcohol. Both of these are intoxicants. I believe they should, if a person is over 21, given all the education there is about tobacco from grade school on up, I think they should be able to decide for themselves. And incidentally, self-autonomy has also public health consequences. So when people are denied self-autonomy, it has been shown in studies that their health is adversely affected. So I think if we allow adults to decide for themselves regarding regarding marijuana and alcohol, both intoxicants, we should allow them to make their own decisions regarding tobacco and nicotine products, neither of which impair judgment or compromise driving skills. Thank you.
Thank you, Stephen.
And thank you for your written comments also, Stephen. I received those and distributed those to the board members.
And thank you for your courtesy.
Okay, I'm not sure what happened, but
So Emily should be the next person.
okay, Emily, I'll send you an invite now to join as a panelist.
Hi, thank you. My name is Emily Ouija, and I live at 231 Brookline Street in Cambridge. I'm a private citizen with no affiliation, and I've spoken to the board previously, I think some months back, and I have emailed some testimony previously, but I'm happy to email that to you again to be included in the official record. I just wanted to speak up again during this official public hearing as well, just to make sure to get my voice heard. I'll try not to be too repetitive, but I'm strongly opposed to this generational tobacco and nicotine ban because I'm really concerned about adult agency and liberty. In my opinion, all you really need to consider with this proposal is that the age to buy tobacco and nicotine in Massachusetts is already 21. There's no need for this policy. It's simply wrong to remove adult choice for tobacco and nicotine when we live in a society that values allowing adult consumers to choose addictive substances and practices, such as alcohol, marijuana, and lottery gambling. I think we all know people in our lives who have quit addictive practices such as those mentioned. In fact, tobacco use and vaping among teens is declining. So in response, I feel what you're doing is really entertaining a proposal to take a sledgehammer to adult choice and ban tobacco and nicotine in all forms without investing in adequate education. And I thought the point that Stephen Helfer made about autonomy being also really important. part of public health. I thought that was a great point. So I just ask you to please vote against this proposal and stand up against stifling of free choice and the infantilization of adults. Thank you very much.
Thank you, Emily.
So Chetan Shukla is next.
Yes, I have just sent you an invite to be promoted to a panelist.
Hi.
My name's Chetan Shukla. I'm 23 years old. I'm from Dover on Perry Lane, just off Walpole Street. And I'm here to speak in favor of the nicotine-free generation regulation. I've never testified at a board meeting before, but this is an issue I'm passionate about, and I'm positive this change would benefit the Dover community immensely. I'm a recent graduate of Brown University, where I studied behavioral decision sciences on a pre-medical track. Through my studies, I investigated medical decision-making on a global scale, with my senior capstone project focusing on smoking cessation policies across 6 different countries. This led me to my current job at Massachusetts General Hospital's Cancer Center, where I'm a clinical research coordinator investigating methods of early detection for lung cancer. While it's easy to read in a textbook that tobacco use is widely recognized as the leading preventable cause of death globally, with about 8 million smoking-related deaths per year, it was not truly prevalent in my worldview until I began my current work at MGH. While speaking to patients, I've learned firsthand about the disastrous effects of smoking, with many specifically stating that they wish they had never started smoking tobacco. This connects directly back to my prior research at Brown, wherein I learned that 99% of people who use nicotine products begin before they turn 26, and 90% begin as teenagers. This staggering statistic truly underscores the fact that most people start smoking while they're still developing judgment, and once people start, it's very difficult to quit. Even though they are then adults, using nicotine no longer feels like a choice. Therefore, a nicotine-free generation would help the Dover community greatly. I love my upbringing in Dover. It truly is an amazingly unique place to grow up. However, I do remember seeing vapes for the first time in a parking lot of Carroll Park after playing tennis with my parents. This is why I was so excited to learn that Dover is considering joining the 18 other cities and towns that have adopted the nicotine-free generation already. Not only will this help the future of Dover prosper, but is also undoubtedly the right side of history in the fight against tobacco. In conclusion, I urge you to vote yes on the proposal in support of the health of Dover youth. Thank you for your time and your service to our beautiful town.
Thank you for speaking.
Thank you.
Okay, it looks like Alex is next, so I will send you an invite now to be a panelist.
So Alex, you're not muted, but we can't hear you.
How about now?
That's a little better, very faint, but try
How
again.
about now? How about now?
Much better.
Little
All right, Alex Weatherall. I've been here twice before. I own Sherborne
Better.
Fuel in Sherborne. I'm opposed to this. You may remember, my opposition is on a fairly narrow ground. I sell tobacco products, cigarettes, and some very few, but some cigars, and nicotine pouches. I don't sell any vapes, any e-cigarettes of any kind. I don't believe in it. I think they're unhealthy, et cetera, et cetera. And you've heard me say before that, in my view, which is based on 15 years experience, this NFG activity is purely performative. It's not practical. And I say that because using my store as a guide, the consumption of combustible tobacco is absolutely cratering. What I've done to counter that is an awful lot of things. Most recently, I've built a $500,000 commercial kitchen, and my sales in my little store in Sherborne are up over 40% year to date as a result of that, despite the fact that tobacco, which historically is a C-store's biggest category, is down double digits. It has been, and frankly, I'm proud of the fact that it's down. Consumption, the uptake of combustible tobacco products by young people is vanishingly small, especially in towns like Sherborne and Dover. And I think my narrow opposition comes from the fact that if today nicotine in any form, then what tomorrow? Caffeine, sugary drinks, energy drinks? It's a bad precedent, it's impractical, and will have no effect. That's really about it. I can't add anything more to what I've said in the past, but those are my thoughts, for better or worse. Thanks very much.
Thank you for coming to speak again.
Okay, it looks like Shrista is next. Apologies if I'm butchering that, but I will send you an invite now to be a panelist.
Go ahead.
My name is Shrista Chekulum, and I am a junior at Natick High School. I'm a student who has witnessed my peers go through nicotine addiction. I know that this step makes them more likely to fall into even worse other substances, affecting their entire future. Therefore, I believe protecting them from access to these substances is extremely important, and therefore adopting the nicotine-free generation policy in Dover is the perfect next step. As a part of my youth group at Natick High School, Natick Above the Influence, I can guarantee that youth want to see this for their future, as they do not wish to have access to poisonous products nor support the industry selling them. As you know, youth are extremely vulnerable to long-term addiction. Getting addicted now could mean becoming a slave to nicotine for the rest of their lives. I can guarantee you that no student or person wishes for that. However, even knowing the harms that tobacco can have on students, the big tobacco industries will not stop, creating more flavors and varieties of products as a way to entice youth. I also wanted to respond to some of the other comments made. Although smoking rates among youth may be low now, and even vaping rates may be slowing down, I hope you all remember that first spike in youth usage of vaping products, where many youth fell into addiction and are still using today, impacting their daily lives. We cannot wait for something to happen before we react. We need to take proactive, preventative action for the future and make sure that other products like nicotine pouches or who knows what else will be regulated with the NFG policy. Therefore, I and many other youth must believe that this must end now, and an endgame policy is the best way to fight back against the industries and protect our youth. I believe that Dover is a safe, healthy community where families choose to raise their children. This policy reflects those same values. Change starts from one town and spreads to the next. This is why I request you to help fight back and do your part by voting in favor of the nicotine-free generation policy. Thank you.
Thank you for speaking.
So it looks like Isabel is next. I will send you an invite now to become a panelist.
Oh, sorry, can you hear me?
Yes.
Okay, perfect. Hi, thank you so much for the opportunity to speak. I know that you're super busy, so I'll try to keep it brief. I'm a high school senior from Needham, so just one town over. And Needham recently passed nicotine-free generation, which I'm super grateful for. As a high school student, I've seen countless friends and peers succumb to nicotine and tobacco addiction. I know that some people have talked about self-autonomy and the right to choose today, and how, passing nicotine-free generation would take away the right to choose to use nicotine and tobacco products for the rising generation of young people. However, I've had countless peers express that they feel that they are so addicted to these products that they can't stop using. I think that when we think about the rights that we want to protect for young people, would we rather value the right to purchase products that ultimately kill up to 50% of users when they use them in their intended way? Or would we like to protect the ability for young people to grow up free of addiction? The industry has said publicly and within their documents that they intend to target young people with their products. I know that people today have again said that smoking rates are lowered and that vaping rates are lowered, but I have still seen countless peers using these products. I'd especially like to say that I've seen so many peers using nicotine pouches. I know that it was said that the use remains low, but that is not what I have seen from my personal experience. This past weekend, it was Halloween, so I got to see lots of friends, but I also got to see lots of substance misuse. Even on Friday, in my high school parking lot, I saw seniors in high school selling nicotine pouches to freshmen in high school. To me, that's really jarring because we're talking about, for one, that, when we ban these products, we're only banning them for older students. However, again, like these older students are maybe getting them from friends who are 21 or 22. And then when these older students have access to them, then the younger students can get them from their older peers who are 17 and 18. But I think as the age restriction gets higher and higher and higher, it's harder to have a 30-year-old friend who can purchase you a nicotine or tobacco products to pass down to a 13 or 14-year-old. I also do a program in my Talents Middle School where I work with 12-year-olds, 13-year-olds, and 14-year-olds. And again, when I meet with these students, I ask them what their biggest concern is within the middle school, because the programs focus on mental health and advocacy skills. And again, they bring up to me that the number one concern that they have is nicotine and tobacco product addiction. These are 12-year-olds, 13-year-olds, and 14-year-olds whose primary concern is not social problems, is not anxiety around school, is not around tests. It's about their friends being addicted to products that might ultimately kill them. To me, that's really scary, and to me, that's really sad. And I hope that today we can put people over profit and ban nicotine and tobacco products. I will also say that I have testified within other towns, and I've seen again and again that the industry is willing to show up. They're willing to put profit over people. I've passed out flyers outside of Bellingham High School. Right next to me outside of Bellingham High School was a tobacco company consultant also passing out flyers against the policy promoting nicotine and tobacco use. And this is out of high school. So again, I would like to ask you to see through today some manipulation from the industry, and again, put the youth of Dover above profit. And again, if we're selling products that, kill people, maybe that's not the best business model, and we should be putting our youth first. And that's not to say that small business retailers don't have good intentions, but I think, when we're counting what's most important to us, that should be a priority, health first. Thank you so much. And yeah, I'll stop talking now.
Thank you, Isabel.
It looks like John is next. I will send you an invite now to be promoted to a panelist.
Hello. My name's Daly. I'm a Dover resident. I live at Pine Street, and I'm a recent graduate from Bryant University, and I work in IT securities. And I just wanted to say I'm very concerned with this whole ban of nicotine. We have 2 stores in Dover, and we're going to severely affect their business. And it's not going to cause any ban to addiction. You're just going to create a 2-class system where anybody born in 2005, they can't get this product. But if you're born in 2004, you're A-okay. And really what this is going to do is it's going to push people to Millis, where they're going to go to Comcan, which is a weed store, and they're going to get weed. And weed is a terrible substance, and it's extremely addictive, and it does severe damage to the brain. And I've seen countless friends of mine from my high school that smoke marijuana, and what it does to them is it makes them a dope. And that's what we're going to end up doing to this generation, is we're going to push them into a substance that is a gateway drug to some of the most severe and, life ruining material. And I don't see how telling anybody, oh, just because you're born on this date, you can't buy this product, even if you're 21. Like, you should be able to make that choice if you want to, smoke a cigarette to calm your nerves, whatever it may be. It doesn't seem right to say, you can't get this. I'm 23. I don't smoke nicotine, but I don't think it's fair to say you can't do it just because, people in the year 2025 voted on this day and said, oh, we voted, although you're 21, you can't make this choice, you can't make this purchase. Thank you. Have a nice night.
Thank you for coming to speak, John.
Next it looks like Jabbar. Apologies if I'm butchering that, but I will send you an invite now to become a panelist.
Hi.
Hey.
My name is Jabbar. I'm from Dover Mobile. My father, Mike, owns the mobile station. We've been there since 2006. So Stephen earlier mentioned a lot of the points that I was going to talk about. First, in regards of business-wise, where tobacco and nicotine sale account for, majority of store sales in every store out there, not just us. But again, just putting a ban on it not only hurts the business, but it devalues it greatly, looking at numbers that way. And as mentioned before, also, if you're 21, you have the choice to gamble, you have the choice to buy alcohol, but now in Dover, you don't have the choice to buy a pack of cigarettes if you choose to, which I don't think is fair at all. In regards to the comments about, saving the youth, I'm 34 years old, and it's been a little while since I was in high school, but when I was in high school, the number one thing was alcohol, and hearing people talk about it now, it's pretty much still the same thing. So if you really want to talk about saving the youth, I think something should be done towards alcohol before discussing this ban in Dover. That's all I have to say, but majority of the stuff was mentioned by Stephen and others that are opposed to this, which I also am. Thank you.
Thank you for speaking.
It looks like Michael is next. I will promote you to a panelist.
Can you hear me now?
Yes.
My name is Mike Sassine. I am the owner of Dover Mobile, like my son mentioned. And I don't want to repeat what he said, but just a comment. We're definitely not promoting tobacco product to high schoolers. The people who comes to buy cigarette, we ID them. We take their driver license, we punch it into the cash register, and it will automatically tell us if they are allowed to buy tobacco product or not. But this is a part of the business. That's what we sell. We sell tobacco, we sell soda, we sell candies, besides, among other things. And I believe if you ban it in Dover for as little as we sell, but it also little from here, little from there, that's what we need at the end of the day, is gonna make it or break it for the overall health industry. I don't think every person in Dover who smokes come to our gas station and buy. Most of the people who buy cigarettes or tobacco product are the people who comes to work for the town of Dover, the landscapers, the painters, the tradesmen, and everybody else. So it will definitely affect our business, because the people who walk in the station to buy a pack of cigarettes, they also buy something else. So this is a business we are in. Again, I am not saying this to promote smoking to younger generation. The people who buys, they're 21 or older, and if they don't buy it from Dover, they go to the next town. And as you all know now, if they don't want to go anywhere from their couch, they can go online and order it, and it comes to the doorstep. So we are not the one who's promoting, and I would urge you to consider our business. We need all the help we can, and thank you very much for giving me the opportunity to speak. Thank you.
Thank you for coming to speak at the meeting.
It looks like Peter is next, so I'll send you an invite now to become a panelist.
Hey, good evening. Peter Brennan, Executive Director, New England Convenience Store and Energy Marketers Association. Had the honor to speak with you a couple times already. Here again in opposition to the nicotine-free generation policy. As the other people in opposition have stated, in various ways, this will harm our businesses. This will be completely ineffective in curbing youth nicotine usage. To the example that the young lady mentioned earlier of people selling products in a school parking lot, well, I mean, if you're 18, then it would be illegal to have those products anyway. So my guess would be that they got them on the internet, where generally you can get all sorts of products with no IDs being checked, no age verification, unlike what we do in our stores, which is keep things behind the counter where youth can't access them, check and scan IDs, and make sure that only 21-year-olds purchase these products. To the retailers that spoke, they make great points. To various degrees, nicotine is going to make up some percentage of your in-store sales. But the biggest thing in our industry is that if somebody can't buy that product at your store, they're going to go to another store. And then you're going to lose that whole basket of goods. So anything else they would have purchased. And that is really the biggest concern. Certainly, we're very concerned about the limitation on adults' rights and liberties. At some point, you are an adult. You should be able to make adult choices. That's why we've made the age to consume these products 21. And that's the case for alcohol, cannabis, tobacco, gambling, and the list goes on. So, very much opposed to this. Happy to take any questions. I've submitted written testimony, and I thank you for your time.
Thank you for joining us and speaking, Peter.
Always a pleasure.
Okay, it looks like Kate is next. I just sent you an invite to become a panelist.
Thank you also, by the way, Peter, for sharing your written materials. I made sure to share that with the board ahead of the meeting.
Hi, thank you. I wasn't going to testify tonight, but then because I'm not from Dover, my name is Kate Solbaugh, but then I have that in common with the members of the Smoking Rights Organization and the Trade Association. So then I decided I would speak. I'm from Brookline. I'm a professor of law at Boston University, and I think about youth health and safety regulation. I just wanted to address a couple of the points that have been made. One of them had to do with smoking rates being lower, and I know this board understands the difference between combustibles and vapes, and that the combustible rate has dropped. And I think one of the retailers mentioned that, but that doesn't really speak to the intense nicotine content in the vapes, which is much higher than it is in cigarettes, and that once you have that addictive function coming out of the vape, the odds are you're going to end up being a dual user at some point in your life and be using combustibles. So there's that issue is a little bit complex. Some people have mentioned, well, what about sugary drinks and what about alcohol and what about gambling and cannabis and so forth. And I think to believe that point, you really have to push aside what is really the unique status of nicotine. And so I just want to remind us that the unique status of nicotine, unlike alcohol, gambling, and cannabis, is that according to the CDC, it is addictive like heroin, not like alcohol, and incredibly difficult to quit, that most people will try to quit 8 times before they're successful, that the vast majority of people want to quit and most attempt to quit and fail. So it is not the same kind of drug. Also, it is far, far more harmful, just to remind us that eventually it kills half of its users, that it is the leading cause of preventable death globally and in the United States, that it's implicated in 1 in 5 deaths in the United States. It's in a completely different harm category. And in fact, if it weren't for its addictiveness, it would have gone the way of lead paint, it would have gone the way of asbestos, which are not as harmful, but are also not addictive. So I just think it's important to keep in mind that from a public health standpoint, nicotine is in its own class in terms of harms. I also wanted to speak to, a lot of people made this point that people would just go to the next town over and that the retailers would lose money. And so 2 things to say about that. One is there's ample public health evidence that proximity to outlets is a determinant, a really strong determinant of people initiating the use of products. So, and we have that even with respect to tobacco 21. At one point, Needham raised their age to 21 and everyone stayed around them for years at 18. And when they did that, even as a little island, they saw their youth tobacco rate drop 50%, which is a number you never see in public health. And I think you guys are aware of that, even though they could have just gone next door. Did some obviously continue going next door? Sure. But a 50% effect out of a local reg is really quite impressive. And finally, just speaking about that money question about the retailers and the money, when you become addicted to this product as a child, as a youth, you will spend thousands and thousands of dollars every year on this product. And that is a form of impingement on your freedom as you're addicted to it. But if you are not addicted to this product, those thousands of dollars will stay in your pocket and be spent in your community in other ways. These dollars are not going to leave the Dover community. They're going to be spent on ice cream. They're going to be spent in other ways in the Dover community. That money doesn't just vaporize if it doesn't go to nicotine. It goes someplace else. Again, I just would remind you that you only use this product if you start using it in your youth. That's the only people who use this product. So if we can continue to push that age up, there won't be anyone in your social network who can purchase this for you. And that's by and large where youth get the product, from people in their social network. 18, 19-year-olds don't have 26 and 27-year-olds in their social network, and 26 and 27-year-olds know not to buy for young people because they have exited developmental adolescence. So I just really encourage you to join the other 18 cities and towns. The UK is about to adopt these. It's been adopted in the Maldives. It's on the roll, and it's been introduced in 5 state legislatures. And I just would really encourage you to join what is going to be the forward movement here on this incredibly deadly product. Thank you.
Thank you, Kate.
It looks like Mark is next. So I will send you an invite now to become a panelist.
Hi, thank you. Mark Gottlieb. I'm the executive director of the Public Health Advocacy Institute. And I'm actually going to offer a little testimony that addresses a concern that I believe was raised in the prior meeting. And I'll explain why. I think there was a question raised in the prior meeting about whether members of the board could perhaps be ensnarled in litigation were nicotine-free generation, health regulation, amended regulation passed, and then legally challenged in a lawsuit. And I helped to defend the town of Brookline, which was in fact challenged when they were the first in the world to enact this this policy. For several years, my organization, which is a nonprofit law firm, had made the offer through the Mass Association of Health Boards to defend any town that was challenged that, in Massachusetts that went forward with this policy. So we were taken up on that. We defended the town. And in fact, in the town, all of the members of the select board were also named as defendants. We defended all of that to the Supreme Judicial Court. We won a unanimous decision that I think completely clarified the legality of this policy in Massachusetts. I also wanted to mention that I previously had offered to defend the Dover Board of Health in the town of Dover back in 2019 when you were considering a restriction on flavored tobacco product sales. Stephen, I think you were on the board at that time in 2019 and may have recalled that letter offering that. That offer, of course, still stands, although I believe there's about no chance that there's any sort of legal issues that remain to be litigated around this particular policy. Aside from that, obviously I'm a proponent of this policy, have been for about almost 20 years now. I just wanted to say, listening to the prior testimony, in my mind, autonomy is living free from chemical addiction. That's really my idea of what autonomy is. I think that the data is clear that 75% of tobacco users who are nicotine dependent wish they had never started, wish they could quit. And I think this is the kind of policy that can make that wish come true for the next generation and generations thereafter. I also wanted to remind you all that no current customers of any of your retailers are affected by this policy. It's a decades-long phase out, not a ban in the way most people think of a ban, like the flavor ban, which occurred all at once. All those products are off the shelves. This will take decades to kick in, and the impact on retailers will be extremely gentle and slow and gives them adequate time to find other ways to replace nicotine revenue. And I also just disagree with the notion that phasing out cigarettes and vapes will promote cannabis addiction in Dover. I don't think there's any evidence that suggests that's the case. I hope, as Professor Silbaugh had mentioned, that you join, I think, what's a growing movement in Massachusetts and around the world in enacting a generational approach to an end game for tobacco products and nicotine addiction for the next generations. Thank you very much.
Thank you for coming to speak, Mark.
Looks like the next person with their hand up is M. Busby. So I'll send you an invite now to be promoted to a panelist.
You're muted.
No, she's not muted, but we
She's
can't
not
hear you.
muted. We can't hear her. Still can't hear you.
Now you're muted. Try to say something. No. You're muted right now if you take off mute.
Try unmuting yourself though, and try again.
You guys want to circle back and let Maureen troubleshoot a little bit?
Oh, wait, she just unmuted herself. Let's
Yeah.
try.
Is this working now?
Yes, it is.
Okay, I'll be very brief. I sent in written testimony, which I believe you have, so I won't repeat everything I said there. I just wanted to address the idea that customers are ID'd and that
Can you introduce yourself first? Your
Oh.
title, your address, where you're from, and your title, please.
Unmuted.
We can hear you.
No,
but
we can hear you. Your name, put on
Oh,
your
I'm sorry.
headphones.
Okay. Maureen Busby from Melrose, Massachusetts. And I sent in written testimony, and I won't repeat everything I said in my written testimony. I just wanted to mention one thing.
Maureen, your professional affiliation too?
Oh, I'm sorry. I'm a regional tobacco prevention program coordinator for 7 communities, 6 of which have adopted NFG. So I've been, like Mark, I've been working on NFG for a while. 6 boards of health in this region were the 6 in the world to adopt this policy. And I wasn't going to speak tonight, but I just wanted to address what one of the other speakers said about the stores IDing young customers. I wish that were the case. It's required in Massachusetts that all tobacco purchasers be ID'd, but I do compliance checks with youth, underage youth. I send them into the store to make sure that stores aren't selling to them. And I regret that I have to let you know that in many cases, stores do indeed sell to youth, never ask for an ID. And this is one of the problems that we have with with relying on stores to keep youth from having these products. Also, one other thing, we do know from surveying youth that the most common way that they get their tobacco products is from someone in their social network, which a previous speaker mentioned, but not only someone in their network, they get the products from somewhere in their network and sometimes sell them to someone in their network. There are actually entrepreneurial endeavors in the schools where a kid gets a hold of a fair amount of product and then sells it to other kids. So we have a lot of reason to be concerned about what's happening in our schools, vaping, nicotine pouch use, all with much higher nicotine content than our combustible cigarettes. So just wanted to add that to comments that I've already submitted. And sorry about the problems with my video and audio. Thanks very much.
Thank you for your comments.
Okay, it looks like the next person with their hand up is Zachary Rich. So I will send you an invite now to be promoted to a panelist.
All right. Thank you so much for your time. My name is Zachary Rich. I'm a physician and I live in Newton, Massachusetts, and I treat patients at Boston Medical Center that come from all over the state, including from Dover. I'm a pulmonologist and critical care specialist. I make my living and I pay my mortgage by treating patients with advanced lung disease and tobacco-related diseases. I'm coming here really to take time out of my day to encourage you to do what you can for the future of Dover residents and support this legislation. You can do more with this than I ever can. The patients that I see, almost all of them say, I wish I had never started smoking. I wish I had never started vaping. They have suffered for decades and decades and decades after making and being targeted for using nicotine products when they were a youth. All of them typically start when they were a youth and then they suffer for it for decades and decades, and they're embarrassed by it. It costs them their health and it costs them their money. Really, this nicotine use disorder it should be thought of as a pediatric disease because it is people that start when they're adolescents and their brains are still developing. People generally do not turn 40 and say, yes, now I want to start smoking cigarettes. If you don't get addicted when you're young, you don't become addicted when you're older. Again, I really would encourage you to think of this as an opportune time for the board to act. We have seen the board act in the cases of public health in the past, whether it be for leaded gasoline or asbestos. And I've never heard someone say, hey, I wish I could buy some asbestos. Do you know where I can buy some asbestos? But every day I hear people say, I wish I had never started. Lastly, I come to you as a parent, and that I would just ask, how do you think you would respond to what age would you want your kid to start smoking? And I don't care if you're a Republican, Democrat, anywhere in the middle, everyone typically answers that the same. And I think that's why nicotine-free generation legislations are enjoying broad support from both Republican and Democrat and all over the United States and all over the world. Thank you very much for your time, and I again invite you to pass NFG legislation. Thank you.
Thank you, Dr. Rich.
Okay, so it looks like one of the last hands that I can see is from Ken. So I will send you an invite now to be promoted to a panelist.
Oh, here I am. Good evening. Thank you for holding this hearing. I'm a member now in my 6th year of the Belchtown Board of Health, so I can speak to you as a member of Board of Health. We passed nicotine-free generation last December, effective in January. So we're now, what's the arithmetic, 10 months into it. So far, the pushback has been essentially zero. We passed it. The store, we put up the little signs that you can only sell it for people born after the effective date. We heard from one of our nicotine licensees who has a store on our major intersection of 2 state highways. And he said, yeah, maybe we reject 3 people every few weeks who want to buy nicotine who were born after that date, who are, 3 months older, 4 months older than 21. It's been negligible. And all the scary stuff that we're hearing from some of the people in the industry is just not relevant. It's not likely, perhaps in 10 years it'll be relevant. I want to tell you the last municipality that passed it, which is less than 2 weeks ago, was the town of South Hadley. After the vote, which was unanimous in favor of nicotine-free generation, one of the members said that when he first heard from us, which was last winter, he thought the idea was crazy. Crazy was the word he used. And he said over the past now 10 months, he realized that this makes a lot of sense. Because what you're going to do is save lives. A vote yes tonight will definitely save lives. Are you going to save 1,000 lives? No. Are you going to save dozens of lives? Maybe. But you'll certainly save some 17-year-old or 14-year-old who will not die at age 40. My grandfather died at 49. I never got to see him. He never got to see me. He died of cancer. I've been fortunate to meet my own grandchildren, and they know me, and one hopes will remember me. So I encourage you to vote yes tonight. Save some lives. It is perhaps saving lives is the most important reason for serving on our boards of health. Thank you.
Thank you for coming to speak.
It looks like the
There are two.
next hand is Tina. So I will send you an invite now to be promoted to a panelist.
Yes, hi, guys. Think I'm one of the few Dover residents who are attending this meeting. Number one, I want to thank you. Everything in this world has been nationalized, so I give you a
Justine, could you please state your name and your
Oh, I'm
address?
sorry. Justine Kent Uredam, 23 Haven Street, Dover, Mass. I want to thank you guys for, as I said before, I'm here because my husband said, what is this mailing that we got the other day in our PO box in Dover? I said, I have no freaking idea. And so that's why I'm here. It has nothing to do with any of you other than I want to know what's going on. Number two, I'm sort of shocked, but why should I be, that everything at a local level is now becoming nationalized. Number three, I did smoke as a teenager. I do not smoke now. My husband doesn't smoke. My kids don't smoke. Having said all that, I think the Board of Health, if you're going to go through with this at town, first of all, is this a regulation by you guys, or is this going to town meeting? That's the first question I have. The second question is, if it's going to town meeting, I think you need to do a lot more education to the general public, like my husband, who does not follow Dover politics. And thank you for serving on the Board of Health. I know 2 out of the 3 of you are medical doctors, and you do not have to have other people tell you the dangers of smoking. I believe, John, you're a PhD, but whatever. If this does go to town meeting, and my husband especially would be interested to know, why are we dealing with this? Because there are only 2 distributors, as far as I know, in Dover who sell cigarettes. Okay?
Thank you, Justine. Thank you
Thank
for
you.
coming. Thanks for speaking.
Yep.
Looks like the next person in line is Janet. So I will send you an invite now to be promoted.
Thank you. Can you hear me?
Yes.
Yes.
I'm Janet Greenwood, 1 Ann's Way in Dover. I started smoking at 16. I smoked 2.5 packs a day until I was 46. I tried 10, 15 times to quit. I had a very senior executive role at a major bank in New York City, and I sat at my desk and smoked. And the chairman of the bank often spoke to me about how unprofessional it was. I tried hypnosis. I tried everything. It took me forever to quit. It was extremely painful. I'm thankful I did quit when I did, and so far, so good. Not the same for my brother, who also started at 16 and died at 53 from renal cell cancer caused by cigarettes. So as I think about this, if we could stop any one person from starting, I think it's such an important thing. Thank you.
Thank you for speaking, Janet. Do we have any other hands raised?
Not at present.
Last call if anyone else wants to be heard on this.
Okay, then I will entertain a motion to close the hearing.
So moved. Seconded.
All in favor? I, Kay Peterson.
Hi, Stephen Krusko.
Hi, John Quackenbush.
The hearing is now ended, and it's time for the board to deliberate.
Okay, do you mind? Can I just answer one of the questions that was asked by one of our
Sure.
last speakers?
Please.
So this is a Board of Health regulation, meaning it only requires a Board of Health vote. So it's not something that would be on town meeting.
Thanks for mentioning that. Do we have any other testimony that was submitted that is different from what was said in this meeting, in the hearing? Do we have any other?
No, actually, every comment we received, the person spoke tonight, so.
That's great.
Yep.
Good. And John mentioned in the chat that he thanked people for coming, and I want to say that it was great that so many came and expressed so many different opinions. I think you raised almost all the issues I can think of, and with remarkably little repetition. So thank you all. This is not testimony, but I would like to just mention before we start to discuss that the state is that a bill has been introduced at the state level to enact this kind of legislation statewide. It's not clear where it is at this point. Somebody may know, but I don't. But I do know that the Mass Medical Society has submitted testimony in support of that bill, making many of the points that were made tonight by some of the public health people who attended this meeting or attended the hearing. I think I'd like us all to talk about our thoughts about this, where we are with it at this point. Who would like to begin? Steve.
Well, I'm surprised that there are so few people from Dover who spoke out one way or the other regarding this issue. Over the last few months, I've spoken to individuals who overwhelmingly were against the issue, but I guess not so overwhelming that they had the interest and concern to appear at this meeting and speak what their concerns were. It is very striking that 75% of our speakers were not from Dover. So we're not really gauging the waters of what the real depth of feeling is regarding this issue in Dover. And we're not hearing at all about the concerns of a possibility of governmental overreach regarding this issue. But be that as it may, the lack of concern of Dover residents regarding the passing of this issue opens the door to our passing it quite widely.
Okay, I just wanted to mention just kind of a little piggyback off of what Steve just said. There was one written comment we received where the person didn't speak this evening. It is a Dover resident, as far as I can tell. All they wrote was, "Please vote no on nicotine-free generation." I just wanted to share that. Just
Okay.
He was talking about Dover resident.
Yeah.
So, I really appreciate everyone's comments and thank you, Steve, for providing your insights. Yeah, I've been thinking about this quite a bit. I've talked to quite a few people in town too. My experience is that most of the people I've spoken to support the idea of passing this change in our town bylaws. And so, it would have been great to hear more people here tonight to really get a sense of it. I think part of the difference is just the people we tend to interact with. But if you think about it, the arguments sort of fall into a few broad classes, right? You've talked a little bit about, and a few of our speakers talked about fairness, rights. You characterized it as government overreach, and I think that's one way to think about it. We heard some of the arguments about the potential impact on businesses, but then also some experiences from some other places where, because this is a gradual and progressive halt to tobacco sales, that everyone who's currently buying will be able to continue to purchase those products. So the impact might be minimized and will give our businesses in town a greater time to be able to sort of catch up. One of the things that I found in doing some research that other people have raised in other towns is just some unintended consequences, like people, with black markets or other things. I think Dover is a little bit too small to really worry about that being a major issue, although it seems like that's part of the issue that we heard some of the students address, that there are already people sort of selling nicotine products to students. And that's really what this is trying to address. So, I think most of the arguments against have been arguments about the economic impact, or as you characterized it, sort of government overreach in terms of individual rights. And we heard a few people testify about that. On the other hand, if we think about this from a public health perspective, and one of the most powerful addictive substances that we know of is nicotine. We know that nicotine use, particularly in the form of tobacco products, has been tied to increased risks of a large number of cancers, many pulmonary diseases. We know that mutations in the nicotinic receptor are one of the greatest risk factors for developing many of these diseases, including COPD and lung cancer. But we're not just talking about cigarette smoking. And the one thing that sort of surprised me in the discussion today is that there wasn't that much discussion of other nicotine products, many of which we know are the first exposure that students, when they're younger, have before they go on and become really addicted to nicotine products in the form of cigarettes or vaping. So, nicotine and tobacco use is the leading cause of preventable death and disease. It has a high healthcare cost, and that's a burden that we all share. If I look at this as a public policy, what we're really talking about is a gradual phase-in of a policy that will discourage, it doesn't criminalize smoking, but it does prevent the sales, and will discourage sales, discourage tobacco and other nicotine product use among younger people. And I think that's really important. And I thank the speakers who raised this issue. I think this is something that's really important in terms of thinking about how we as a Board of Health look to address our main charge, which is protecting public health in the town. So, I think we have to balance both of these. Personally, if I think about this, I think the public health aspects outweigh, which is going to be long-term and gradual, is going to outweighs the potential economic impact, which is also going to be long-term and gradual. But I think as a Board of Health, it's our responsibility to take this step and pass this change in the bylaws. Kate?
I would echo what you're saying. I've done some investigation about nicotine use and the changes in delivery methods of nicotine over time. I think it's the change is evidence of the tobacco industry's attempts to continue to addict younger people. The flavors, the childlike delivery systems, and now nicotine pouches are all strategies that are being used to continue to addict youth. It's hard to get any good data about how much nicotine pouches are taking hold, but I did find a report from the University of Southern California that showed that in a sample of 10,000 high school students who were surveyed, the incidence of use of nicotine pouches had doubled in 1 year between 2022 and 2023. And that's very striking. It wasn't a high number, but it had doubled in 1 year. And I suspect that if we knew more, we would see numbers like that continuing. I don't think that this is certainly this regulation, and if it becomes enacted at the state level, we're not going to see the end of this struggle, but I think it's a step forward that we need to take. It's very hard for me to have a Board of Health argue that we should be protecting the economic interests of convenience store owners, partly when that economic impact is relatively minor, particularly at this stage, and when it's at the expense of the health of people who are really unsuspecting, who are not suspecting at all about how severely their lives are going to be impacted by nicotine addiction. So I'm strongly in favor of enacting the regulation.
I think you raised a really important point, Kay, and it was one I had thought of raising as well. Just the duplicity of the tobacco industry in trying all sorts of different ways of getting younger people to start to use nicotine products. The pouches, a lot of these high nicotine vapes. I mean, there's always, I think, some motivation on their part to try to come up with better ways of getting this into the hands of young people, even if they can't legally buy it. One of the other things that I think about a lot too is one of the people who offered testimony today talked about cannabis versus tobacco. And while, I've known some people who've become addicted to cannabis, THC is far less addictive than nicotine. So, it's something like 3/4 of the people who try smoking end up becoming daily users. Although it does happen in people who are using THC products, it's at a far lower rate. And this is something I don't think we have any dispensaries in town in Dover. So this really isn't an issue for us. But if we think about, the long-term impacts on younger people in the town, I agree with you. I think this is something that's an important step that the board can take.
I would also say that it's not a zero-sum game. I've said that before. And if it's important to deal with THC, marijuana abuse in this town, then that should be something we should be getting involved in, and alcohol as well. And
yes,
there certainly are groups of people in town who are involved in those on those fronts as well. They're very important, but it's not one versus the other. I had one other thing I wanted to mention, and that is that in addition to the risk of addiction, there are effects of nicotine on the brain, and it is generally thought that that young developing brains are more susceptible to the impact of nicotine, and that the effects are on parts of the brain that regulate judgment, impulse control, and so forth. And that nicotine can be harmful cognitively as a consequence. So I think that's just another factor in my thinking that we should be doing everything we can to keep young high school students and young adults away from this.
Well, one of the things I noticed and really appreciated too, and I do want to thank both the younger people from our town, but also surrounding towns who came to speak. I thought it was really striking that they were the ones, that they as a group were really strongly supportive of this. And I think that says a lot.
I think it does. I agree.
So Steve, you haven't said anything in a while.
And then you didn't hear my comment only about 7 minutes ago.
No, I did. I wonder if there's anything you want to add.
No, I think that arguments have been made and they are cogent, and there's no amount of strong support against this measure in town, so we can move forward.
Would someone like to make a motion?
I move that we adopt the nicotine-free generation policy that's been presented on the town website and discussed at this evening's meeting.
Jason, do you think we should add anything to that language, or does that seem adequate to you?
I mean, I guess the only thing I might add is, as I mentioned to start off, there was a few housekeeping things we had to update as well within our existing regulation. Just as far as protocol for checking IDs, signage. So if we can capture it somehow where we just say, we're adopting the NFG in addition to, these other proposed amendments for our existing tobacco regulation or something to that effect. Does that make sense?
Yes. So I'll start over then. I propose we adopt the nicotine-free generation policy as presented on our town website, together with the other modifications that are necessary to be made to our current tobacco license policy as outlined by Health Director Belmonte earlier in today's meeting.
Seem okay, Jason? All right. All in favor? Aye, Kay Peterson.
Aye, John Quackenbush.
Aye, Stephen Croscall.
Measure passes. Thank you, everyone on the Board of Health, and thank you to all the attendees and those of you who spoke and those who didn't. We appreciate your being here and paying attention to this. It's a very important issue. Thank you again.
Again, thank you for everyone for such a thoughtful discussion.
Anyone else have anything to say? So
Many of our attendings the numbers are going
Leaving.
down, so many of them
Yeah.
are leaving.
do you want to, someone want to move that we adjourn?
I move that we adjourn.
Second.
All in favor? Aye, Kay Peterson.
Aye, John Quackenbush.
Aye, Stephen Croscall.
Okay. Good night, everyone.
Thank you, Sophia, for all your hard work tonight. Jason, thanks as always. Gail, thank you for coming.
Thanks, everyone.
Where are you, Sophia?
I'm at school. I'm in a random classroom.
I saw people going behind you. Where are you going to school now?
I go to Brandeis.
Okay. All right. Well, get back to studying then.
Okay.
All right.
Thank you. Thank you, everyone.
Bye, everyone. Thank you.
Thank you.
Bye-bye.
Night.